Good afternoon, everyone. My name is Selena Ashley Cortez from Our Lady of Fatima University. And for this written demonstration, I will be performing bed bath, shampooing, oral care, and back massage to a conscious patient. So the first thing that I will do is check the patient's chart to see if the patient has physical limitations. So by doing this, I can ensure that I can prevent any injuries for the patient and I can be as careful as I can be all throughout the procedure. So after that, I will now gather all my equipments here at the side. So by gathering all the equipments at the side, we will make sure that the procedure will flow easily and that me and my patient's time and energy will be conserved all throughout the procedure. So after that, I will now perform hand hygiene and wear my gloves. So now that I have performed hand hygiene and I have worn my gloves, I can now identify my patient and assess their ability to participate to the procedure. So, good afternoon, sir. My name is Selena Ashley Cortez, your student nurse from Our Lady of Fatima University, and I will be performing bed bath, shampooing, oral care, and back massage for today. So may I ask your name and your age, sir?
Good afternoon po. I am Jindal Joyrowag Siliwanag and I am 16 years old po.
Okay, sir. So, this procedure won't take long and won't cause any pain, sir. So, can I ask, sir, can you move comfortably with your hands and your legs, sir? Or do you need assistance all throughout the procedure, sir?
I don't love assistance, but is it okay if I'm the one cleaning my chest and also private areas?
Okay, sir. Noted, sir. So, now that you have assessed the ability of the patient, you can now provide the patient's privacy so that they can feel comfortable all throughout the procedure. So, sir, please allow me to close the door so I can ensure your privacy all throughout the procedure, sir.
Okay po.
Okay, sir. Thank you, sir. After providing the patient's privacy, we can now offer the patient a urinal or bedpan so that we can ensure that once we start the procedure, there will be no more interruption. So, sir, would you like a bedpan or a urinal, sir, before we start?
No, thank you po.
Okay, so now that we have confirmed that the patient does not need a bedpan or urinal, we can start by putting bath towels into the patient. So, the first bath towel is we will put it all throughout the patient's body. So, once the bath towel is already covered in the patient's body, we can ask the patient to hold the bath towel. So, while pulling the linen, the bath towel won't go with the linen too. So, sir, can you please hold onto the bath towel while I pull the linen, sir? Thank you. So after pulling the linen, we can now put this into the hamper. So after that, we will put another bath towel into the patient's chest. And then one in the patient's head. So we put bath towels to the patient so that we can ensure that even though the linen is not covered anymore, their privacy is still covered with the bath towel, and so that when we start washing the patient's body, the water won't drip from the bed and won't cause any moisture for the bed and won't get damp. So after putting all the bath towels, we can now start with the washing. So before washing, I have a basin of warm water here, and we have to ask the patient if it's okay for them, if they want it more colder or hotter. So, sir, can you please touch the water? Is it okay, sir? Do you want it hotter or colder?
Okay na po.
Okay, sir. So, after confirming, we can now start washing the patient's face. So, we will get one washcloth, and then there's a possibility that the excess cloth would irritate the patient's skin. So, we will start with the patient's eyes. Each side of the cloth should be with each side of the eye. So, inner canthus to outer canthus. 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 So after washing the patient's eyes, we can now start with the face, neck, and the ears. So, sir. So after that, we can wash the cloth again while we prepare for the washing of the arms. So we will get this bath towel at the chest of the patient and fold it lengthwise, and then put it here under the patient's hand. So Excuse me, sir. Thank you, sir. So we put a bath towel here. So when we wash the patient's hands and arms, we can prevent the water from spilling. So we will get the washcloth. Then we will wash the patient's hand from the forearm to the upper arm using mild strokes, because long mild strokes can promote relaxation and comfortability. So forearm to the upper arm and into the axilla. So we are gonna do it on the same side. So excuse me, sir. So before doing the other side, you should ensure that the patient's arm is dry, so that if there is any moisture, we can remove it. Excuse me, sir. Forearm onto the upper arm and into the axilla. So after that, we are now ready to wash the lower extremities of the body. But don't forget to dry the arms of the patient. So, excuse me, sir. Put it back here. So, the chest and the perianal should also be clean. But since the patient has requested that he wants independence over washing his chest and his perianal, we should respect the patient's request. So we can start now at the lower extremities of the patient's body. So you will only expose the parts of the patient that will be clean, because we want our patient's privacy to not be violated. So sir, follow us. Thank you, sir. So after that, we will start in the ankle up unto the knee. So this stimulates the venous return of the patient. So don't forget to dry the patient's leg. So after that, you will do the next, the other leg of the patient. So, sir, can you please raise your leg, sir? Thank you. So ankle until the knee, up to the knee. So do not forget to dry the patient's legs. So after that, we are gonna wash the patient's hands. Excuse me, sir. Pakitaas po yung hands, sir. So we wash the hands because we want to remove the debris on the skin. Excuse me, sir. So do not forget to dry the hands of the patient. Please raise your hand, sir. Thank you, sir. Okay, sir, thank you, sir. Do not forget to dry the patient's hands. So after that, we will also wash the patient's feet. So sir, pakitaas po yung feet. So we are cleaning the feet so that we can ensure that there are no debris here, and so there will be no source of any infections that will start. So do not forget to dry the feet so that the moisture won't cause any skin infections. Repeat, sir. Thank you. Okay, sir. Pakita po. Thank you po. Do not forget to dry the feet, especially the crevices of the toes. Thank you. So after that, we are going to put this back into the patient's chest and change the water and change gloves so that we can start preparing for the washing of the patient's back. Now that I have performed hand hygiene and I have another basin here of water, we can now ask the patient to move to the side so we can clean the patient's back. So we have to we have to hide the parts of the body that will not include in the washing. So sir, can you please lie on your side, sir? So do not forget to fix the bath towel and put it here. I will pull your clothes up, sir. Is it okay?
Okay.
So get the other washcloth so that you can start washing the patient's back. Sir, I will start washing your back, sir.
Okay po.
So by cleaning the patient's back, we will stimulate circulation here, and it will also aid in comfortability of the patient. So we will set this aside, and then do not forget to dry the patient's back. So after that, we will offer the patient a back massage. So sir, would you like to have a back massage, sir?
Yes po.
So offering a back massage will also aid in circulation and in relaxation. So I will use a lotion so I can use it as a lubricant. Because if you do not use lotion, skin will get irritated by the friction because it is dry. So I will start with sir. So after that, I will now pull the patient's clothes down and tell the patient to position themselves comfortably. So sir, please position yourself comfortably while I prepare for shampooing. Sir. So I will now change my gloves so that I can prepare for the shampooing. So now that I've worn my gloves, I am now gonna start shampooing. So we are gonna shampoo the patient so that we can lessen or we can stop the buildup of oil or dandruff in the patient's heads, and so that they can also feel comfortable. So as of the moment, we do not have a shampoo tray here. So let's just assume that there is a shampoo tray under the patient's head. So before we start, I have a pitcher here and a shampoo. So this is what we are gonna use. But before we wash the hair, we are gonna put a washcloth in the patient's forehead so that when we start putting shampoo, we are going to prevent the shampoo from getting into the eyes of the patient, which will cause irritation. So we will get the pitcher and wash the patient's hair first with water. So assume that this pitcher has water. Now after that, we will get the shampoo, put this in your hands, and you massage it with your hands, and after that, we will massage it into the patient's hair and scalp. So by doing this, we can ensure that the shampoo is spread evenly, and that if there are dandruffs or any buildup, we can locate them easily. So after that, we will get the pitcher and rinse the shampoo of the patient. So assume that the shampoo has been rinsed, and then we are going to dry the patient's hair using a towel on his head. So after that, we will remove the bath towel and the towel under the patient's head. So we do shampooing so that we can ensure that there are no buildups or any dirt in the patient's head, so that they can feel comfortable all through their stay in the hospital. So after that, we will do oral care. So we will ask the patient to sit. So sir, can you please sit down? And then I have a basin here and the pitcher with water and toothbrush and the toothpaste. So the first thing we will do is ask the patient to gargle the water and spit. Sir, can you please sit properly? Thank you, sir. So after spitting the water, so let's assume that there is water, we will ask the patient to we will brush the patient's teeth. So we are gonna put toothpaste, an amount of toothpaste, and brush the patient's teeth. So assume that I am brushing the patient's teeth thoroughly, and after that, we are gonna ask the patient to gargle and spit the water again. So by doing this, we are sure that the patient is clean of bad breath and the buildup of plaque is safe from him. So we can also floss the patient so that if there are plaques left in the patient's teeth, we can ensure that they are removed. So after that, we are going to ask the patient to position themselves comfortably. Sir, do you want to lie down, sir?
Yes po.
Okay, sir, let me remove this for you. So after removing the bath towel that was in the patient's chest, we will change the gloves again and sanitize. now that we have changed into clean gloves and have sanitized, we are going to change the bath towel that's covered by the patient into a new linen so that they can be more comfortable and they can rest properly already. So, get your linen and then open it, sir. Hold on to the linen so while I hold the bath towel. So the bath towel in a circular motion ensures that if there are debris or any soiled things inside the bath towel can be kept inside since it's rolled and will not spread. So after that, you will remove your gloves and clean your hands. That is how you do bed bath, shampooing, oral care, and back massage.